Okay, because we have a quorum.
Okay.
Okay.
So is there anything more than just, I mean, because I'm free that night and
I think just being there and answering any questions if they have it and making sure they understand that the Board of Health is in favor of it.
That's the part I'm maybe have a little lack of confidence about. Could I answer any questions that come up?
I
maybe.
should think that you wouldn't have to, because I mean, you read it. It's all basically boilerplate legalese, and Donna has reviewed it and presumably given her blessing.
Right.
The reason this didn't happen at the last meeting was that they hadn't heard from Donna yet.
Oh, okay.
I would gladly do it, but I'm leaving tomorrow morning for a 9-day trip to North Carolina.
Uh-huh.
What part?
Not sure about the reception.
Sure.
Right. Where are you going in North Carolina?
Good question. My wife's business partner lives down there. We're visiting her. It's on the coast.
Oh, nice.
Oh, nice.
Very nice.
I don't remember the name of the town. Like, is it Charlotte? Is that there? No.
Charlotte's not on the coast.
Oh.
But-
I'll fix.
And Charleston isn't in North Carolina, so that's not.
Yeah.
Only place I've ever been in North Carolina was Asheville. It was lovely.
It is
Asheville's
lovely
a
in
nice
Asheville.
town, isn't
Yeah.
it?
I spent 10 days with my sister after she had knee surgery. So I was there to help her out because she lives alone. She lives outside of Raleigh. It's very nice there too.
Yeah, there's a lot of pretty country down there.
Yeah.
Unless you need an abortion after 12 weeks, then you're out of
Then
luck.
it's not so nice.
No.
Right. Right.
Probably we're all good on that.
Hi, Garrett.
Greetings. Happy allergy season.
Oh,
Yeah, no kidding.
That's you to you.
Right. I have inhaled about a pound of pollen in the last couple
Oh
of
my
days.
gosh.
What's your favorite allergy med?
So the only one that really works for me is Benadryl. So I am a zombie most of the time.
Right. So when Garrett falls asleep in the middle of this meeting,
Right.
we excuse him.
Oh, I thought you said we were going to text him.
That's too bad. The other ones don't work.
Yeah.
Really? Yeah.
Noreen, we can't see you yet. There you
There
are.
she is.
Here I am.
Hey,
Hey,
Noreen,
Noreen.
could you do something? Could
Oh,
you?
geez. What now?
Boy, she's not here 5 seconds and she's being
Yeah.
asked to do something more.
What I was going to ask you to do is go to your name in the participants, and there's a little box with 3 little dots of things you can do.
Yeah.
And if you click on that, it will tell you that you could rename yourself. And then instead of being Noreen's iPad, you could be named Noreen Pease. And I just thought
yes,
that
I
might be
think-
good for if anybody watches the video, it would be good to have.
Right.
a full
I've
name.
tried that and I think it's different on the iPad.
Let me see if I can do it from here as the host.
When I do that, I get meeting settings, background and effects, maybe background and effects. I don't
Here,
know.
I think I can do it from here because
Okay.
I'm the host here.
Oh, it says Noreen Pease now.
Ooh, Noreen Pease. Just like a giant spider. And
Accomplished.
All right,
Well
great.
done.
Thank you.
okay, so I guess we better start the meeting. We've already been recording because we had a quorum while we were talking. So this is the meeting of what? Is this the 17th?
Correct.
Mhm.
May 17th, 2023. The entire board is here. Catherine Hilton, Arlene Reed, Wim Levine, Garrett Simonson, and Noreen iPad Pease are all
Stop.
here. And can we quickly approve the minutes of last meeting?
Yes,
So
I
moved. Yeah.
moved to, yeah, a second.
Okay, any objections? All right, let's just consider it done. Somebody noticed a small error in date when I sent them around, and I changed, so it's all good. Things to update on. Well, first, let's talk about the IMA. Apparently, the IMA has been vetted by Donna because Becky has put it on the select board agenda for next Tuesday. And she's going to need somebody to be there. She said it's probably only going to take 5 minutes, if that. So I just need somebody that will go there and sort of just be the Board of Health presence on it.
I can't on Tuesday.
I would be happy to do that. I don't know how able I would be to field any questions that come up from the select board. I would do my best. If someone else feels they want to do it and could speak to it better than I, then go for it. But
that could only be Noreen because I'm not free on Tuesday evening.
Let me see. I don't have my calendar right in front of me. I know I'm out of town Sunday and Monday. I think I'm back Tuesday. What time is the meeting? Or it's a Zoom meeting?
Yeah, it's a Zoom meeting. I don't think the agenda is set yet, so I don't know what time it's happening. I don't know what
Okay,
time.
why don't we both go just in case?
Sure.
If that's okay with you, Arlene? And,
Yes.
I'm pretty sure I can, I'm pretty sure I'm back in time to do that.
okay. And if you're not, I'll go and I'll do my very best. Having read, I will reread the IMA beforehand and our minutes from, or my notes from both minutes and my notes from our previous meetings, and try to answer as well as I can.
Yeah, I think some of the main points, just to reassure people, is that all the town councils and the city council in Greenfield have looked at it.
Mhm.
It was originally drafted with the assistance of the Massachusetts Public Health Association, and they, have helped us all along and will answer any questions or concerns.
I think Noreen, it's not MPHA. I think it's MAHB who worked on it.
Okay.
Mhm. Okay.
Yeah,
I'm sorry, you said it has been reviewed by which communities?
All of the.
All of the others.
all 6 of the towns and
Okay.
their council.
Okay.
And I think the other thing is we've learned from the other public health excellence grants around the state that have been in existence for a number of years now. And this latest iteration is the best to date because we've taken
Mhm.
all of the knowledge and learnings from all of those
Okay.
groups and applied them to this iteration. Those
Okay.
would be some of my key points.
Okay.
Well, great. Thank you both for taking that on.
Welcome.
Yes.
There was a particular thing I wanted to, the mosquito district. Nothing is resolved. Nobody, as you probably know, nobody went to that meeting of the commissioners of the district because John said they couldn't address the problem there, not only because it wasn't already on the agenda, but because it's kind of it's above their pay grade. And so I guess the state board of reclamation or somebody has to deal with it. And he said they would set a meeting of some kind and they will inform us about it. Meanwhile, I went out on the field with that guy. It was quite educational. We went all over town for hours. I learned to use a little dipper and get a larvae out of mucky water, and I've watched him take samples from cattails. The cattail ones, the only cattails we found, by the way. I mean, there's the one down on the south end of the lake, but there was also some around Atkins Reservoir. And and those are the ones that he could get actually close to. And the mosquitoes that are associated with cattails, and I forget which disease they have, they cling in near the roots, under the muck, and then they slowly come up, but in the roots. And so what he had was a bilge pump, and it was like a roasting pan and colander kind of set up, and he would just shoot up some water from down at the bottom of the cattail and put it into this thing and then shake it out. But he didn't find any, which is a good thing.
I have been, since our last meeting, trying to think of places in town with cattails. And
we went over to Julian's and we didn't see any at all. We had a nice time walking around there, but no cattails.
I did think about the south end of the lake, so I'm glad to hear you say there were some there.
What about you? I'm sorry.
I did not think about Atkins Reservoir. Go ahead.
What about your property, Wim? Aren't there plenty up there?
There's a lot of Phragmites, but there are also cattails. Yes.
Yeah.
What's your number there?
The street address is 585 Wendell.
Okay. Okay. I'll tell John about it.
And I'd be happy. I'd like to walk around with them. I just wasn't available.
Yeah. Nobody was. And I was not anticipating spending several hours. But it was fun, it was interesting and fun, and we got to just kind of walk around.
Do you have to wear high rubber boots when you go walking with him?
I have mostly waterproof boots, and I just didn't go where it was really deep. He put on some really deep boots to get into the cattails.
Sure.
I don't know that we heard from the previous person who was in that role, but I was impressed by his presentation to us.
Yes.
Yeah, he's a live wire.
Yeah.
I was impressed also.
Knowledgeable. Seems like he's doing a lot of academic work in the area as well. So
yeah, I agree.
Not only that, but in the work that he was doing over in the central part of the state, he also did beaver stuff. He can like put in those water flow control devices, and he can recognize. I mean, we saw some at Julian's, and he said, he could recognize Mike Callahan's work, and certain ways that it was put together and mounted and stuff. So he's kind of interested in possibly expanding his role.
That's great to know.
Yes.
Yeah, very cool. Speaking of beaver stuff, I wrote an order for for breaching a dam and also for putting in a water flow control device down at Dudley Pond, which is down the very bottom of Montague Road, just before the Leverett line. And they've been having all kinds of problems there with backup and flooding. And that was the one that was on next door that people were getting so exercised about.
Right.
So I think that water flow control device was going to be put in today. So there it is. Another thing, and since we actually have a meeting, I mean, a lot of these things I just do them because I can't wait for a meeting. They need an emergency order over at Lake Wyola State Park. You know where that bench is? It's on a little deck right at the water. And then there was a sort of a ramp that went down, like for handicapped access into the lake, that went down there. Well, that's all broken up. And so they want to remove. Yeah, yeah, not the part where the bench is, but the other part. And so they need to remove that because it's a safety hazard. And so because it's next to the lake, it's in a wetland, and they had to get an emergency declaration from Concom. And Concom says they can't write any emergency certifications unless somebody else gives an order that it has to be fixed. And so Miriam asked the police and the fire and me, and they haven't answered. So with your agreement, I will just write an order saying, please take.
Yeah, please do. For me. Do we need to vote on that?
If you want.
I move to allow Kat to write an order for replacement of the ramp in front of the bench and at the state. beach.
Second.
Favor?
Aye.
Yep, no objection.
Yes.
Arlene, yes.
All right, yes.
Yes. Wim, did you vote? I didn't hear
Yes.
you.
Win,
Okay.
yes.
Okay,
Thanks.
all right, I will do that.
Good.
So I can
Thanks.
get that fixed. Is there anything else out there that we are?
I would appreciate an update on the demolition of I've forgotten the address, whether it's 55 Wendell Road or whatever, Greg Steve's place.
56, summer 56. I don't have one, but I will get one for our next meeting.
I feel like it's been several meetings since we've heard
Yeah, it
anything.
has.
And
It has.
I think we're supposed to every other month anyway. Every other month or every other meeting? I guess it's every other month.
We were doing it every month, but we weren't getting much progress.
Because
Yeah,
last I recall, he had said spring. He was
Well,
confident spring.
and here we are, this is spring.
Yeah.
Right, so yeah, I will undertake to get a report from
I
him.
get more and more people kind of casually saying, so what's going on with that? And I think we should stay on top of it.
Yeah, I totally agree with you. Not that there's anything we can really do about it, but at least we can be informed.
Yeah.
Okay, I'll work on that bit.
Okay.
Are there more things to be updated on?
Yes, I'd like to make a couple of updates. One is on the Valley Health Collaborative. And I think Arlene had asked me who was hired as our nurse, and it's Sarah Fisk.
Good.
Arlene. And I believe she's starting the 19th. That's just off the top of my head. She's going to be in orientation.
The 19th of May or
19th
of June?
Of May.
Okay.
That's only a couple days from now.
Yeah, and I think she's going to be orienting down in Greenfield. Hopefully we'll have the IMA signed soon, possibly after the next select board meeting. And then she can come into town and we wouldn't have to worry about any sort of liability kinds of concerns if the IMA is signed.
Okay.
Which also means that we probably, a group of us should go and look at the room down in the basement and see what we might need to do to ready it for her to begin some work up here sometime early in June. Anybody volunteer to help me to do that?
Yeah.
I'd love to do that. Should we do it when she can come, or should we just do it in advance?
Well, I'm hoping maybe, with Arlene and us, I think she's probably going to need a desk. I don't know what else she might, a table. I need to get to Greenfield and pick up some supplies that are there for her. But because of my eye surgery, I can't lift much right at the moment for the next couple of weeks. So I may have to ask somebody else to go and pick up those supplies because I'm still a couple of weeks out from being able to lift much.
Okay, but supplies does not include a desk, or does it?
That's a good question. I know we bought some things. I will ask Jen if we have bought those kinds of things for our public health nurses.
The room, when was it used last? Do you know what's in there now?
I've been
And-
in there recently. It's the senior lounge and it's set up pretty, I mean, it's not just a big pile of stored tables and stuff, or at least it wasn't last time I was in there. The library volunteers were using it. Their tables were set up and it was a kind of usable room.
And I think I checked, maybe this board told me that the water supply, or I think we were talking about, she will need access to water for a number of reasons. And I was told that the kitchen, adjacent to that room would be adequate for the water supply she might need. And there are 2 bathrooms down there too. So I would think that.
Right, there's 2 bathrooms, there's the kitchen and there's a bottled setup, a bottled water dispenser for drinking water.
Right. Okay, I think that's everything on Valley Health Collaborative, although I would like to say, I think I emailed everybody that I had an occasion where my doctor had to report a communicable issue to the public health source. And within an hour and a half of that report being made, I had a call back from the public health nurse in Greenfield, who was delightful, and not our person, but the person who was covering at the time for our collaborative. And I was pretty impressed with that. I thought that was pretty darn good.
On that note, I've forgotten what date this was effective, but going back a few weeks now, it is now, even before the public health nurse was hired, it was determined that the public health nurses who are part of the City of Greenfield Health Department would take over the Maven coverage for the town of Shutesbury. And so the primary person doing that right now is someone named Mary Ellen Sloan, with a backup of Megan Tudrin. And to tell you the truth, full disclosure, I still check it every day.
Okay, good.
But there has been almost zero activity for a few months now. So Noreen's experience being one exception, and one case, maybe 2 cases of COVID. Most people who are diagnosed with COVID are doing home testing, and so that doesn't come through in Maven. And even when one does come through in Maven, we are no longer required to pursue every case. But so only those that represent a cluster or occurring in a high risk setting, like a long-term care facility or something like that.
So I think that's great to report. Although we missed talking to Arlene, I certainly did. It's really great to know that the other person is there, and she was also delightful to talk to and got back, was right on that. So that was great, Mary Ellen. Okay, so
Noreen, if you need help retrieving the supplies from Greenfield, I can help you with that.
Oh, that'd be great, Garrett. Okay.
Depending on when it is, I could also help. Dates to be determined. I think I need to go soon, probably sometime in June, to Denver for, I don't know how long. My daughter has kind of blown up her knee in a skiing accident, and she's going to need surgery. So I'm going to be going to Denver for, I'm not sure how long. Sometime soon.
Noreen, if there are furnishings, I've got my truck. I'm happy to do that.
Oh,
too.
great.
Yes, I will find out. The original discussion was simply supplies, but we were trying to spend down the money for that particular grant for this fiscal year too. So I don't know if there are desks and chairs or anything like that. I'll find out. So thank you. And we just picked them up at the public health office in Greenfield, which is on Sanderson Street, I believe. So I'll just coordinate all that with either you, Arlene, or with Garrett. And
reach out.
So sorry to hear about Susan, Arlene. That is a bummer.
No, she'll be fine. She's still going in and doing surgeries and stuff.
Oh, wow. Wow.
But we'll see.
Okay.
Post-op, she won't be able to do so much. So we'll see.
Great. All right. Well, for me, turning now to MAFCO, I have a little bit of good news with that regard. The state, Gail Bienvenu, who is our contact person for this region of, this is the Public Health Emergency Preparedness Grant, WIM, that is under the umbrella of MAFCO, which is the Mohawk Area Public Health Coalition. Anyway, the state has heard our cries from MAFCO of concerns that we're having with FERCOG, and has been working with Carolyn and I to really kind of mediate the relations that have taken place. And the result has been that we have been able to determine how much money was left in this grant year, which ends the 1st of July. We have been able to purchase equipment using that money, and we have been working on a work plan for the upcoming fiscal year, and all reaching consensus on that. The other point that is key to make is part of the concerns had to do with the after action review for COVID that was done on behalf of MAFCO for the entire county. And the steering committee has been reluctant to endorse the recommendations of that group in a public way. And we believe at this point we have gotten FERCOG to back off from a position of wanting to present those recommendations to the full coalition at its annual meeting in June. And that was stated by Linda Dunlobby in a public meeting in which these two state officials were present last week. So we are hoping that will be the case. And hopefully we will continue to work with the two state representatives as we move forward and plan where we do need to go in the upcoming fiscal year and in the new iteration. It's hopeful that it's a 5-year cycle. Is that right, Garrett?
Yeah, we're in 4 or 5 of the current funding, CDC funding for public health preparedness. So 1 more year of this current cycle, and then we'll go into the next 5-year period.
Yeah, so the plan is to kind of begin to talk about also where we would go in the beginning of the new 5-year cycle, and taking into account all of the public health excellence grant groups in Franklin County, of which there are 3, I believe. So the other thing I'd like to let everybody know is the annual meeting of MAFCO is going to take place on the 21st of June. It's going to be at Terraza. I believe it's starting at 5 o'clock. The invitation hasn't gone out yet, but I'm hopeful that everyone would be interested and willing to attend that annual meeting this year. If you're around, I understand. If you're not, Arlene, for sure. Part of the agenda is going to be talking with other FEP coalitions in the area, one of which is Worcester's, and I think another, not one of yours, Garrett, I don't believe. Oh, maybe Hampshire counties, about how they have taken a look at their own future, how they want to organize, who should be on the steering committee, what kind of gaps we learned about that exist for emergency preparedness as a result of COVID. So there'll be presenters talking about what their coalitions have learned about those things. And then we're just going to do some basic 101 kind of training on the, help me, Garrett, there are 12 like principles, FEP principles, they're not called principles, capabilities, 12 capabilities.
15.
Yeah, so just giving the group an overview of what that is about, because apparently in Phoebe's Public Health Excellence Grant group alone, there are 30 new Board of Health members. So there are a lot of new people that don't really know what this is about. So it's part of it is going to be a sort of orientation. And the final point I want to make is what has gone into our work plan for next year is indeed to have a in-person training for web EOC, including handouts that will teach all of us again, or those of us who are designated to respond to, these are emergency drills, Wim, that come in, and towns need to be able to respond and say, yes, I can be there, to help with this emergency situation. So there'll be training for that will be planned, and we'll let you know ahead of time when those are going to occur.
Great.
I think that's it.
Fantastic.
Noreen, I didn't quite follow the part about the AAR. Could you go back over that? I don't understand what the issues are here.
Oh boy, how do I put this succinctly? FERCog and some entities, including the FERCog board, have made some recommendations resulting from the AAR reviews. And there were two that were done post-COVID. One was done for MAFCO, and the second one was done for FERCog in general to kind of evaluate how we all did, what needs to be improved, that kind of thing. Apparently, the FERCog board endorsed these recommendations, and FERCog was moving forward to enact them and brief all these boards across the county as to what was going on, without explaining to the steering committee, the legal steering committee that is appointed by this coalition to really provide the leadership.
So they were bypassing the MAFCO steering committee and trying to just put out recommendations without your approval.
Yes.
And they were also just utilizing the FERCog after action review. So Kat, the one that you, Noreen, and I, and the fire chief, and I think Becky even went to that one. There were two separate reviews, and the one that public health was really more involved in was sort of sidelined, in my opinion. But and so they were utilizing the organizational review, for COG's organizational review, to kind of push these changes, I think.
Changes that I'll say, in my opinion, might be more driven by, maybe this isn't fair, I probably shouldn't say it publicly, but maybe motivations
that don't have to do with public health.
Correct.
Got it.
That's possible. So anyway, we're back on track. We've got several very good persons from the state who are helping us navigate and negotiate this whole process. And we're hoping there'll be a much more open-ended and inclusive process down the road in the upcoming fiscal year and beginning for the next BP cycle to look at how we should reorganize. We're not objecting to reorganizing, but we think there ought to be a broader discussion of it. And certainly the steering committee that's been working on it for years should be included in that discussion. I know that's long-winded, but it's a tough one to try and summarize, Kat.
No, I get that. I just wanted to kind of understand where, even if it doesn't really make it into the minutes, I just wanted to have a better understanding.
Yeah. Yes, thank you. Thank you for taking the time to have that better understanding. Appreciate it.
Do we have more things we have to talk about? I don't think we have any actual business. All right, then. Shall we just adjourn then?
So moved.
In a second.
In favor?
Yes.
I especially want to adjourn because Garrett, you look so miserable.
I absolutely am. I'm sorry.
Oh my gosh.
No, not at all. We're sorry for you.
No.
Yeah.
You look really unhappy.
Absolute pollen overdose.
Oh,
It's the
man.
I
White
see.
pines, I think, right?
Yeah.
Yeah,
The pines are pollinating already? Usually that doesn't come till June.
go take more Benadryl.
Right,
I
right,
will.
yeah, okay.
When you go out to your vehicle and
Yeah.
that's across,
Yeah, right, you
I
can
know,
write your
right.
name on it,
know exactly what's
Yeah.
going on. So,
right.
Yeah.
Okay, guys, thank you.
Okay.
I hope you feel better soon, Garrett.
thank
Yes, definitely.
you.
Good night.
Good
Bye,
night, all.
everyone.
Bye.